This workshop is ending the cycle of the workshops. It brings together, what happens to the facility, what happens to the staff, what happens to the patients and their relatives. So I think in a way, it's at the core of the whole project.
It seems like there is an increasing lack of respect for healthcare facilities, for healthcare workers, for the right to healthcare.
We're faced with these challenges in our operations every day, from Syria to Sudan to Central African Republic. These are very real challenges, and I'm very pleased to see this group of experts coming together from around the world to discuss these challenges and to try to find jointly both practical and implementable solutions that can help on the ground.
We had the privilege here in Pretoria to get really a good representation from colleagues from the field. So different perspectives of practitioners.
When I worked for Sudanese refugees providing mental health services, working alongside the psychosocial support services, I recall there was no protection there either, and you were out there working, and especially if you're a local health provider. Again, this is another vulnerable group that we need to make sure is protected.
Healthcare services and their protection under conditions of armed conflict, it's imperative and very, very important to be secured.
Il y a les balles qui sifflent. Rentrez à la maison, c'est dangereux pour vous.
Le premier mois de la crise a été le mois le plus grand défi et ça a été le mois le plus émouvant, le plus difficile, mais en tout cas on est ressorti quand même avec de très bons résultats, celui de maintenir la structure de santé, la seule structure dans les 3 régions du Nord à fonctionner. La clé, c'était avoir un personnel qui est engagé, qui est conscient du danger du fait de rester dans une structure de santé, avoir la volonté de faire quelque chose de bien et être transparent vis-à-vis de ceux qui viennent, soit pour agresser, soit pour tirer, pour se soigner. Être transparent sur le fait qu'on est là pour soigner tout le monde dans la diversité, dans la neutralité et dans l'impartialité totale.
And the most important thing is that communication with the surrounding people, gaining their confidence and faithful providing of health care to the patient. We are neutral in behavior. We care for all patients. I think this is the most important point to secure the hospital.
And we don't separate patients. We don't separate patients because that is a matter of security. If you bring, for example, Shabab in one side, soldiers of the government in another side, it is easier to target them. So we mix up and we try that they don't know each other. They are suffering in that time. They are not thinking who they are. They are just patients, and we treat them like that.
It's not good enough anymore to say there is a problem. We really collectively have to come up with solutions.
It's not one solution that will fit all the situation, but basic principles.
Some of the biggest recommendations that have come out for me are just some of the simple protection measures that you could do to ensure that your hospital has at least a minimal protection. So building a wall around your hospital with whatever materials you have available, or making sure that you have proper disposal or understanding of how to put out a fire. All of these kind of minimal risks, knowing that you're never going to be able to deal with everything that comes your way, that you can't predict everything, but that there are small things you could do that could help enhance protection.
Une mesure dont on a discuté est celle autour de la nécessité de sécuriser l'accès autour d'une entrée et d'avoir autour de ces entrées des moyens de contrôle, etc. Réfléchir à des dispositions de sécurisation en temps de paix, permettre de pouvoir mieux faire face à des situations en temps de crise.
Learnings maybe from this is also the very importance of the human element in all of this. We can make the best technological solutions, the best protections, but if we don't care for our staff, if we don't give them the tools, if we don't give them the skills to interact and to de-escalate situations, to better negotiate, to better handle these stresses, then the best systems in the world aren't going to protect.
I felt coming out of the Ottawa workshop, it's like, okay, we have these recommendations, but so do they work? Like, are they, that we need to test them, and we really need either feedback or validation of how effective they are.
And if we can get implementation of the recommendations that are being made, I think, that would be a good thing. So advocacy after this workshop is going to be very, very important.